Our goals of treatment at the Brachial Plexus Center are no different from the goals of treatment at our wider hospital, special surgery, and that's to restore function, mobility.
And the patients who have nerves that are not going to recover, the goal is to provide the information that's going to guide the treatment and get them their function back, and to let them know with these nerve transfers we can restore function that will make you either completely independent or mostly independent, and so it's very valuable in that way.
The first thing we're going to ask a patient when we see them is, what are the things that you cannot do that you would like to do? We generally know overall the categories they want, but I really want to know from the patient themselves.
We want to do what's necessary to restore people's passions, to get them back to the things they love to do. See a patient who's had this injury and we agree to be their care provider. We've essentially contracted with them for 10, 20 years. And you get to know that patient extremely well. And you understand their deficits, their functional losses, their needs. And then when you see them start to recover, it's one of the best feelings.
When you have a patient come in who's very depressed, who thinks that this is it, especially if it's a younger patient, they're going to live the rest of their life without use of a function, even when they don't have function, and I can see the nerves regenerating, to see the patient, and if they're with their parents, I mean, that's to see them have that degree of joy and hope, and you've turned around their whole perspective on the rest of their life. That's pretty gratifying, and how can you not feel great about that?
It's one of the greatest joys of doing what I do. They come in not even being able to bend their arm to bring their hand to their mouth to eat with it. And now, a year and a half later, they're asking about going back to soccer and weightlifting, things like that are just amazing that they get back to not just activities of daily living, but back to their sports and back to their lives that they had before.
There really is no more gratifying feeling than seeing a patient lift their arm up again. It's very powerful, actually.